Hello, everyone. Today we're going to be reviewing healthcare challenges and cultural considerations for American Indian and Alaska Native elders and discussing how the four M's of age-friendly healthcare fit into planning and providing care for this population. The objectives for today's session are to outline the unique healthcare needs and challenges faced by Native American elders, including common health disparities and cultural considerations. Explain the impact of historical trauma and systemic racism on the health and well-being of Native American elders and incorporate this understanding into patient care. And understand how to apply the principles of the geriatric 4 M's, what matters, mentation, medication, and mobility, to develop comprehensive age-friendly care plans for Native American patients. Why does this topic matter? Aging AIAN populations face significant healthcare challenges that demand our attention. Culturally competent care is essential to improving health outcomes and addressing disparities. For example, did you know that AIAN elders have a life expectancy that's 9.6 years lower than the US average? This statistic highlights the urgent need for action. As you can see from the bar graph, the gap in life expectancy is stark, and it highlights the importance of addressing these disparities through culturally sensitive care. Native American elders face unique healthcare challenges, often resulting in higher rates of chronic diseases and poorer health outcomes compared to the general population. Many Native American communities reside in reservations in remote or rural areas with limited access to healthcare facilities and specialists. Long travel distances, as well as healthcare provider shortages, contribute to healthcare access issues. Cultural barriers such as language and lack of interpreters for native languages hindering communication with healthcare providers. Mistrust of the healthcare system and culturally inappropriate care are additional concerns. Complex healthcare and insurance systems and make it difficult to understand health insurance options available through the Indian Health Service, IHS, or other programs. Some experience inadequate coverage for certain services or medications. When planning end-of-life care, consider that there are many cultural sensitivities around death. It may be difficult to discuss end-of-life care due to cultural beliefs and practices. Access to culturally appropriate hospice and palliative care may be limited. Native American elders often cannot afford long-term care or senior living facilities because of economic hardships, including fixed incomes and high poverty rates. This can cause additional strain on family caregivers. AIAN elders face some of the most significant health disparities in the United States, and these disparities have profound implications for their quality of life and longevity. Let's break this down further. First, AIAN elders experience a higher prevalence of chronic diseases such as diabetes and heart disease compared to other populations. Second, mental health concerns are also disproportionately high in AIAN communities. Suicide rates in this population are nearly twice the national average, and this trend is particularly alarming among elders and youth. Mental health issues like depression and anxiety are often exacerbated by unresolved historical trauma, loss of cultural identity, and ongoing systemic racism. These disparities are influenced by social determinants of health, which are the conditions in which people are born, grow, live, work, and age. For AIAN elders, these determinants include nearly 25% of AIAN individuals live below the federal poverty line, making it difficult to afford health care, nutritious food, or safe housing. Lower educational attainment limits, opportunities for economic mobility and health literacy. Overcrowded or substandard housing increases the risk of infectious diseases and exacerbates chronic conditions. Many AIAN communities are in food deserts, where access to fresh produce and healthy options is severely limited. The result? A cycle of poor health outcomes that perpetuates across generations. Addressing these root causes requires a multifaceted approach, improving access to healthcare, addressing systemic inequities, and fostering culturally sensitive interventions that honor AIAN traditions and values. As healthcare providers, we must recognize these disparities not as isolated issues, but as interconnected challenges rooted in history, policy, and social structures. By understanding the broader context, we can begin to take meaningful steps toward improving health outcomes for AIAN elders. To truly understand the challenges faced by AIAN elders, we need to recognize the role of historical trauma. This refers to cumulative emotional and psychological wounding across generations caused by traumatic events. This is a review of information from the presentation on trauma-informed care. Please refer to that module for more details. The impacts of the events shown on this timeline are still felt today. The stress and trauma resulting from these historical events manifest as intergenerational trauma, loss of cultural identity, and increased healthcare disparities and risks of chronic disease and substance abuse within American Indian Alaska Native communities. Understanding historical trauma is crucial for providing culturally sensitive and effective healthcare. By acknowledging and addressing the root causes of these disparities, we can work toward healing and improving health outcomes for AIAN elders. Crucial cultural considerations when providing healthcare to Native American elders should include acknowledging the historical trauma experienced by many tribes while ensuring that care is delivered with deep respect and sensitivity to their unique cultural values. Family-centered care is very important to Native American cultures, in which they highly value family unity. Always involve family members in decision-making and care planning, allowing them to be actively involved in the elder's healthcare journey. Treat Native American elders with utmost respect, recognizing their status as community leaders and knowledge keepers. Be open to incorporating traditional healing practices alongside Western medicine, such as herbal remedies or spiritual ceremonies when appropriate. Understand that spiritual beliefs and spirituality is often deeply intertwined with health and well-being in Native American cultures, and inquire about how spiritual needs can be supported during care. Culturally sensitive communication should be used with clear, simple language, avoid medical jargon, and be mindful of cultural nuances in communication. Additional aspects to consider are to acknowledge the historical trauma experienced by many Native American communities, as it can impact health outcomes and trust in healthcare systems. When possible, provide care within the community or through culturally relevant organizations to ensure familiarity and comfort. Respectfully, ask questions in a sensitive manner, avoiding assumptions about their beliefs or experiences. Consider utilizing culturally competent interpreters when necessary to facilitate accurate communication. Involve local community health workers as a connection to the community. Remember that not all Native American cultures are the same. Different tribes have unique customs and beliefs, so always inquire about an individual's specific cultural practices. Establishing a trusting relationship with the patient is vital for effective care delivery. Healthcare providers should undergo training to gain cultural competence and sensitivity towards Native American patients. When applying the geriatric 4Ms to age-friendly care plans for AIAN patients, healthcare providers should prioritize culturally sensitive communication, incorporate traditional healing practices where appropriate, deeply understand the patient's values and priorities, and conduct thorough assessments across all 4M categories, tailoring interventions to address specific needs and respecting cultural nuances throughout the care process. When considering what matters, begin by initiating a conversation that is sensitive to and honors the patient's cultural beliefs and values, using open-ended questions to understand what is most important to them in their life, including spiritual well-being and family dynamics. Employ language that is respectful and culturally appropriate, considering tribal-specific terms and avoiding stereotypes. Involve community leaders or elders to provide insights into cultural priorities and potential barriers to care. Collaboratively establish patient-centered goals that align with their cultural values and priorities, considering their desired level of independence and quality of life. When assessing mentation, use validated screening tools for cognitive impairment and mental health issues that are culturally sensitive and adapted for American Indian and Alaskan Native populations. Consider language barriers and ensure assessments are conducted in the patient's preferred language or with the aid of a qualified interpreter. Incorporate spiritual support and practices that are important to the patient, such as connecting with traditional healers or incorporating cultural ceremonies if appropriate. Pay close attention to potential signs of depression and suicide, utilizing culturally relevant approaches to intervention and support. When assessing medication, conduct a thorough medication review, considering potential interactions with herbal remedies or traditional medicines commonly used in the community. Patient education should provide clear and culturally appropriate medication information, addressing potential side effects and adherence challenges. Medication dose adjustments should include being mindful of potential genetic variations that may affect medication metabolism within different Native American populations. Collaborate with pharmacists to optimize medication regimens and address any concerns related to medication access. To assess mobility, perform a comprehensive functional assessment that considers the patient's living environment, cultural practices, and potential mobility barriers. Explore culturally appropriate assistive devices and modifications to support mobility and independence within the home setting. Exercise plans should incorporate traditional physical activities or movements that are culturally relevant and accessible. Provide education and support to caregivers, considering their cultural background and needs in managing mobility challenges. Overall, when applying the 4Ms framework to AIAN patients, it is crucial to prioritize cultural competence, engage patients in decision-making, and tailor interventions to address their unique needs and cultural values to ensure high-quality, age-friendly care. To summarize, American Indian and Alaska Native elders face unique healthcare challenges rooted in historical trauma and systemic racism. Cultural sensitivity and community engagement are critical for providing effective care. The Geriatric 4Ms framework offers a practical tool for developing age-friendly care plans that address the unique needs and priorities of AIAN elders. Let's now talk about what you can do to make a difference. Change begins with understanding, and today is an opportunity to take the first step. Reflect on your practice and ask yourself, how can you incorporate these principles into your work? Commit to one action step, whether it's learning more about AIAN culture, collaborating with community leaders, or advocating for culturally sensitive policies in your organization. Here are some resources to help you continue your journey. The National Indian Health Board, Indian Health Service training programs, and publications like Justice for Tribal Elders by Justice in Aging. Together, we can create meaningful change. Here are our references. Thank you for listening to this presentation.